And we are now live, Senators.
Good morning. This is Senate Health and Welfare. It is February 10th. And this morning, we're going to begin taking significant testimony on S56, the child care bill. And just as a heads up, because Senator Hardy asked me earlier, what's the pathway for this bill? And our job is in here to listen to the testimony that we will have. At the same time, next week, I believe the Education Committee is going to be taking testimony with regard to the pre-K sections and the sections that involve them. And then beyond that, we'll just wait and see what testimony dictates to us in terms of how it proceeds, whether it goes directly to education or whether the fiscal notes is the thing that sends it off to other committees. So that's where we are. We're just at the beginning. I guess the important thing for me is that we listen to the testimony and integrate it into our thinking about the bill itself. So with that, I'm going to welcome folks who are on the screen and perhaps in the room, and have our committee introduce themselves to you, and then we'll begin with our first witness after that. So I'm going to start with Senator Hardy this morning.
Hey, Elliot and Nasha, I'm Ruth, you know me.
Well, Terry Williams, I'm the senator from Rutland County. I live in Polk.
Ginny Lyons, Senator representing Chittenden and Southeast.
Dave Weeks, representing Rutland County.
Good morning, Senator Martine LaRoque-Ulick from Burlington.
Okay, we're good. And we'll meet others as we go ahead. So I'm going to say welcome to Elliot Regenstein, and why don't you introduce yourself for the record, and we'll welcome your testimony.
Thank you so much, Senator. And my name is Elliot Regenstein. I am from Foresight Law and Policy, and I had the honor of working with Building Bright Futures over the course of the last couple of years, from 2021 into 2022, on the systems analysis. And I shared that with Alex, and so hopefully you got a link to that in your materials. A couple of years ago, the legislature charged Building Bright Futures with developing the systems analysis, and also charged the legislative office with doing a fiscal analysis that I know has been completed. And my understanding of the reason for that was a recognition of the real need for systems change and a belief that the state's current way of doing business could be improved. We at Foresight were certainly honored to be chosen to lead the systems analysis component of the work in collaboration and partnership with Nasha Patel of Watershed Advisors, who I see is on by phone, but unfortunately was not able to be joining us by video this morning. So during the development of the systems analysis, we were deeply grateful to the Vermont early childhood community for engaging with us as extensively as it did. You can see in Appendix A to our report a listing of the dozens of people we talked to, including members of an advisory committee that regularly engaged with us to offer direction and support. I want to note that Chair Lyons and Senator Hardy are both on that list, and we particularly appreciated their participation. So we heard a lot from those folks, and I want to start by saying that the bill you're currently considering reflects a number of the values that we heard are deeply held within the early childhood community. Those include a need for expanded access to childcare, expanded access to pre-K, and elevated leadership in state government for early childhood. Those values shine through in this legislation, and I think that's important to say because it's useful, to me at least, to clarify where, if there's any disagreement, is it about values or mechanics? And so from a values standpoint, I think this legislation does do a lot to reflect the views of the Vermont early childhood community. There is one core value that we heard a lot about from the early childhood community that I think may not be reflected here, and that was a strong desire from the community to have a unified early childhood system and elevated leadership that's really looking at the entire system as a whole. Reasonable people can certainly disagree about how to execute that, but that to us was a core value that we heard about, and one that it was harder to see in this legislation. That's important, I think, because it does relate to the state's ability to execute on the values that this legislation does embody. Specifically, thinking about the dramatic changes this bill calls for in expanding access to both childcare and pre-K. Again, without getting into the details, it's great to be doing that and exciting to see that energy. But the kind of service expansion that the system needs and that's contemplated in this bill is very complicated. It involves a series of decisions and judgments about personnel and space and quality and access being made at both the state and the local level in a highly dynamic environment where all of the agencies and providers involved are impacting each other on an ongoing basis. And so one concern would be that if decisions about childcare and pre-K being expanded are being administered separately, the state does run some risk of having implementations that compete with each other rather than creating a single coherent system. My understanding was that the reason the legislature wanted a systems analysis in the first place was to achieve that goal of coherence, and to rapidly accelerate policy change without providing for that coherence could make the expansion more challenging for providers and families. I would also note that by moving to primarily school-based pre-K, that's not the national trend. I know you're going to hear more about that from some of the other witnesses today, but that by my count, of the 44 states with a state pre-K program, 41 of them include private providers, 29 as potential primary service providers, and 12 as subcontractors. Mixed delivery systems are generally seen as more responsive to the needs of families, and in our work on the systems analysis, the importance of that mixed delivery system was a consistent theme. I would also note that some states have focused on delivering 3- and 4-year-old services together based on their understanding of the research on best practices in child development. I don't want any of these things that I just said to obscure what are some very important positives in this legislation, and I certainly commend the sponsors of the bill for their willingness to go big and to support the kind of investments the early childhood field sorely needs. That's incredibly exciting, both for Vermont and, again, I think of it in a national perspective, and this is just really tremendous stuff. So I do hope that the conversation the legislature has can maybe focus first on those shared values and then work on the mechanics once the values are agreed to. The value of making major investments in early childhood is already in this bill, and that's a tremendous place to start. The value of a unified system may not be in this bill yet, but it was in the committee's charge that launched the systems analysis. It's in the systems analysis itself. If that value is one the committee still holds, I have no doubt that legislation can be crafted that integrates that value with the ones already embedded in this bill. In the systems analysis, we proposed a strategy for addressing that value. People may or may not agree with the mechanics of our suggestions, just as they may or may not agree with the mechanics of this bill, even in places where they agree with its value. But there are clearly some values that are widely shared, which is a great starting point. And so once the committee determines which values it wants to see reflected in major legislation, it feels eminently possible to develop mechanics for service expansion and state oversight that will allow Vermont to be successful in meeting the needs of children and families. So I'll stop there. I'm just grateful to have had the opportunity to be part of the process, and certainly happy to answer any questions the committee has or engage in any discussion.
Okay, thank you. I'm looking at your written testimony, which is somewhat different from what you have brought to us this morning. So I'm wondering if you could also send in, unless I'm missing something.
I don't know that I submitted written testimony in advance, but I
you
can
did
certainly,
not.
so I can certainly submit what I
had the wrong Elliot.
Okay.
Thank you. But is it possible for you to send your written testimony in to Alex? That would be
For
great.
sure. Well, I'll definitely do that.
All right, excellent. Thank you. We'll take a minute for some questions then. I know the report that you delivered to us in July had specific suggestions about governance structure. Perhaps we could make a couple comments about that report briefly.
Sure. So again, the systems analysis, the main value we were trying to capture in that systems analysis was that what we heard from the field was a strong desire to have elevated leadership that really was looking at the entire early childhood system. And one of the struggles we heard was, and again, this is relatively common in states that have wrestled with this issue, is that there were concerns that the Agency of Education wasn't really set up to work well with private providers, and that the Agency of Human Services wasn't necessarily well set up to work with schools. And what some states have done is create essentially sort of a standalone unit of state government that looks at early childhood and has oversight of what are currently thought of as both education and childcare functions. In the Vermont administrative structure, the idea of creating an entire agency for that purpose seemed excessive to people. And so what we ultimately proposed was essentially sort of a unit that would have a dual reporting structure where it would have a senior leader with oversight of pre-K childcare and some other programs, but that the leader of that unit would report dually to both the Agency of Human Services and Agency of Education. That's modeled on Pennsylvania's structure, and I recognize that that adds some complexity. For us, the highest value was having a standalone unit that really has oversight of early childhood. And in the report, we go into some more detail about different ways to house that unit. I would note that while that does create some complexity at the state government level, that having that standalone unit potentially creates greater simplicity at the community and provider level. So again, we were focused in some ways on how do you shift the burden of managing complexity to state government and away from communities, because in many ways, state government is better equipped to deal with it.
Thank you. That's very helpful. That was a good summary, I think. Questions from the committee on this? This gets us started a little bit. Any other questions?
I don't have a question per se, but just there is a logic to the reason, the structure that's in the bill, and it's not exactly what Elliot recommended in the final report, but it is based on a lot of the findings in that final report. And I could go through some of the reasons why we structured it, if that's appropriate, or
Let's hold that. I mean, this is right. That would be good for discussion when we get to the bill after we've heard more testimony. But of course, we've all worked on this, so we're all.
yeah, I know. It's just there are reasons why we didn't do exactly what Elliot and his team were suggesting and in the bill.
I understand that. And there are reasons why it may be different overall. So let's keep listening to folks and we'll get there.
Thanks.
Yeah.
So Elliot, you mentioned that it is not the national trend to implement childcare in the school system or words to that effect. Can you tell me, from my own background, what is the national trend?
So the trend is more, it has, in talking about a mixed delivery system, it's more the idea that pre-K can be delivered in settings that include both schools and community providers, which sometimes is childcare providers, sometimes is Head Start providers, with the idea being that pre-K, particularly when it only covers a sort of a school day or a certain number of hours per day that doesn't equal what parents' work schedules may be, that what parents really want is to be able to drop their kids somewhere in the morning, pick them up after work, and hopefully have them have an educational experience at some point during that day. So again, there are different models of how that's delivered, but in most states, again, like this is not in the home-based providers typically, but with larger centers where you have a critical mass of children equivalent to a classroom, that they often use some combination of pre-K, childcare, and Head Start funding to deliver a full day of care and then some amount of standards-based education during the day that, it conforms with the state pre-K standards. And again, by doing that, it's seen as making it easier for families to access the service and also, frankly, in some communities, schools don't have room. That's not a situation everywhere, but there are some schools that don't want to necessarily be in the business of delivering pre-K or don't have the space, and that in those communities, having it delivered in community-based settings adds some value. And again, that was something that we heard a lot about in the course of the systems analysis, was a desire to see mixed delivery be, the way that Vermont delivers pre-K.
Thank you.
Okay, thank you, that's helpful. Other questions? Did you want Nasha Patel to testify separately? Are you two together with this?
We coordinated yesterday, and I think she's so I think I've covered sort of the major points that both of us wanted to make.
Okay, all right, good. Is there anything else that we need to be asking you about the report at this time? And obviously, some of us have read the report and been through it a couple of times, and others are less familiar with it. So are there other, would you suggest places in the report that would be most meaningful for us to understand our current system and how you've developed your recommendations?
Yeah, I mean, I think, we tried to have a summary at the beginning that gives sort of an overview of what we found and what our conclusions were. Obviously, reading the full report gives you a much deeper analysis of why we came to the conclusions we did. But I think if, hopefully, there's a 2-page executive summary at the beginning, and if you read that, you at least get the sort of high level piece of that. I would say also that if people have questions later in this hearing or in this process, right, we're certainly happy to answer any questions we can. And I also very much appreciate Senator Hardy's point that I do think, I agree with her that there are a lot of ways in which this overlaps and some good reasons that people might choose different directions. But hopefully this report does serve as a good resource to the committee as a reflection of both what the Vermont community is looking for, and then layered on that is our recommendations, bringing some national perspective to where you might go with that.
Go ahead, Senator Weeks, and then Senator Gulick.
Thank you. Just curious, because I'm not familiar with the report, but I will get a copy and study it.
Yeah.
I'm just not familiar with it. So my curiosity is, in your report, or Madam Chair, in another report, is there an analysis of Vermont's current child care system? Is that embedded in this, in the Foresight Law report?
Ask him a question.
Yeah, so we do give an overview of how the current system is set up. And that's not like the most super in-depth version of that, right? I mean, there are other analyses done by other organizations, including Building Bright Futures, that go into greater depth about the current childcare system. We were really focused on how are the pieces of the system fitting together and how are they managed. So that's what our report is meant to add. And that for the details of administration of childcare and pre-K, I'm sure we can get you other reports if you want to dive deeper into those aspects.
And we did have testimony earlier about from the Agency of Human Services on the different types of childcare centers, how many there are, how many kids. So that's more of the boots on the ground. And then when Bright Futures comes in, we can ask other questions about how that all looks. Yes.
I have a broad question, and it's also coming from someone who is not an expert and has not done a close read of your report. But thank you for the report. I look forward to diving into it. My sense is, again, as someone who's new here, that some of our agencies might be overtaxed, maybe understaffed, but there's a lot of stress on the system as it is right now. And my sense is that this bill attempts to maybe alleviate or shift some of the burden and the stress. And I'm wondering Did you speak to that at all in your report?
We speak to some degree to the capacity needed to do this work well. And I would echo what you just said and what I know Senator Hardy is driving at is that one of the things we've urged both the legislature and the administration to look at is what are the functions that state government needs to perform, and how do you make sure that the agencies responsible for those functions have the capacity needed to perform them. One of the reasons that states have moved toward unified governance is that in many instances, having one administrative scheme for childcare and one administrative scheme for pre-K means that there are certain functions that end up being duplicated. With regard to professional development, they end up having sort of different quality requirements and oversight requirements as opposed to having sort of a more unified approach to oversight. So we talk about that some in the report, and that there are these functions that the state is performing where it might be a more efficient use of capacity to have one unit doing it rather than two. And I wouldn't say that the majority of states have done that kind of consolidation of functions, but if you look at the landscape now as opposed to 20, 25 years ago, there are now, a double-digit number of states that have made some change to try to consolidate that. So that's one of the things we're seeing as you look nationally at the trends.
I mean, when you look at the Agency of Human Services and their staff devoted to the sort of childcare issues, I think it's like 37 or 38 staff members. And if you look at the Agency of Education, there's 3 people for pre-K. So there's a significant difference in the ability for each of those organizations currently to oversee things together. So having an uptick in staffing, more resources makes significant sense. Having some consolidation makes a lot of sense. And the question I would ask for you is, if the governance structure is consolidated as you're suggesting, then which is first? For me, the ultimate goal in our state would be to have a platinum grade pre-K system that involves our schools and our child care centers, or move along to some very beautiful structures and environment for kids. And my question is, if we make the governance shift and some of the changes that you're talking about, will that get us in that direction?
I think it can. I mean, I think one way or another, all of the pieces you're talking about, right? Governance, finance, expansion, right? All of those are going to need multi-year plans, right? Like none of those are things where you can just drop a bunch of money into it next year and snap your fingers and it's done. So there's no reason that you can't come up with a multi-year expansion plan that addresses all of those issues in a thoughtful way. And a number of states that have made governance changes have done so because they were in expansion mode with early childhood services and realized that in the long term, they wanted some different structure to manage the expanded level of resources they were providing. So that's the kind of thing where, again, we identify some of the core principles of that in the report. I wouldn't say there's a detailed plan for a multi-year rollout, but that there are other states that have done that very thoughtfully, New Mexico probably being one of the most recent, and Colorado is in the midst of it now. So there are models you can draw on and apply to the Vermont context to look at what it takes to change governance while expanding services. But in the long term, the vision you describe is absolutely right. And I don't think you have to think of it as like, well, we'll do this one thing and then the other thing, right? If you're thoughtful about it, you can do them together.
Yeah, but it does take time.
It does take time.
For me,
Yes.
becomes, pretty critical. Okay. All right, thank you. Any other questions? This is very helpful. We do have your report on our webpage, and we'll look forward to the testimony in writing. You get that to Alex, that'd be terrific.
Great, and I'll
Are
stay
you-
on the line in case you have any follow-up questions later in the hearing, and thanks again for the opportunity to share these thoughts.
Yes, no, thank you. Very helpful. And are you going to stay with us during the next testimony? That would be good, because things might come up, and if you feel that there's something you can help us with, just raise your hand, please.
Great, I'm here for the duration, and I know you've got some great people about to testify, so I look forward to hearing their wisdom as well.
All right, and so we're going to move along to Lori Connors, who is here. And Lori, why don't you introduce it's Lori Connors Tadros, excuse me. And so why don't you introduce yourself for the record?
Sure. Hi, I'm Lori Connors Tadros. I'm a senior research fellow at the National Institute for Early Education Research at Rutgers University. And hi, Elliot, colleague of Elliot. It's actually very appropriate that I follow him because I think the conversation you've just been having about the system is work that I've done as well about what's kind of a highly effective state office of early learning to support young children. I'm going to share my screen. I sent you some slides. I don't know if you have them in front of you, but
We do. We do. If you
Actually,
can,
it says,
if you,
Alex, it says host is disabled, participant screen sharing.
I'm just giving you permission. You should be all set.
Okay, great. It'll just keep us kind of on track, I think. But as we're getting ready, I just wanted to say that first, I think it's fantastic that you all, the state of Vermont really cares about young children, really thinking hard about what government can do to support young children, and really thinking kind of innovatively and out of the box. I am going to try to present to you, a couple of things. I'm going to present the research. I'm going to hone in specifically around where Vermont stands on high quality universal pre-K. I'm going to talk a little bit about mixed delivery from a national perspective. I did hear the question, so I won't go into too much detail. And then I'm going to give you some reflections. I've been at this for 40 years, a long time. I work quite a bit nationally on really policy-driven research and work across the country. So some of this will be really my own reflections and thoughts and considerations. I've been reading the press that's come out lately about Vermont and about this kind of bold move to really expand access. And so I really do applaud you around that. I know that high quality pre-K has many benefits, but I do want to situate that in the high quality aspect, because unless whatever you do results in high quality for a kind of sustained period of time, you won't get the benefits you want, and there'll be a lot of frustration. So I represent the National Institute for Early Education Research. Our institute was started about 20 years ago by the Pew Charitable Trust based on a campaign they had to support state-funded pre-K, meaning states put dollars into pre-K as you have. For over 20 years, this is going to be our 20th year, we have set policy standards that are the minimum kind of benchmarks based on research about what is a high quality program. And they cover the things that research has identified as important to support young children's learning. And that is, standards and curriculum, the qualifications of the teacher and the assistant teacher and how that continuous improvement is supported, class size, screening and referrals. So these are the benchmarks that we actually measure every state every year for the last 20 years on these benchmarks as a marker to help states see where they stand nationally and to give them some direction for their policymaking. And I'm not sure that, that Vermont has that. You've seen this. There is, your own state profile and where you rank. Vermont can be quite proud of the fact. Whoa, sorry about that. Something just happened.
Are you thinking that your slides are up?
I was, so they're not.
No, they're not. We're just listening and.
Oh, okay. Here we go. Sorry.
Okay,
I think I got it now.
which slide is that? Let's scroll down.
No,
All
that's,
right.
that's the slide she wants, I think.
Yeah.
I'm so sorry. So can you see it?
Yes, we can.
We
Thank you.
also have it on our own screen, so. we
Oh,
can
okay.
follow
All
it,
right.
so-
Sorry. I
No,
love
you're
technology. I mean, technology is great when it works, but
Well, you must be sitting in New Brunswick right now. Is that true?
no, actually, I live in Crofton, Maryland. I've worked remotely for a number of years. I've worked for New York for about 10 years, and I actually work remotely because I work on a national level. But anyway, back to Vermont really quickly, because I know you want to kind of get at your bill
Yeah.
and what the thoughts are. Just to note that Vermont is basically one of the highest in the nation in terms of the number of children served, especially the 4-year-olds, 57%, and 3-year-olds. Your state spending is about ranked 20th. So you're investing a great, pretty good amount in the pre-K program. I think that we have also, you've attempted to really ensure that it is a mixed delivery program with high quality or quality standards in both settings. So I don't know why my screen won't. Hold on a minute. Okay. The part I wanted to point out to you is that Vermont meets 7 of the 10 benchmarks. And while you're doing a good job about, reaching children, there are areas of quality improvement that your policymaking could focus on that could, based on the research, give you better results for young children. So as you can see, you are not requiring a teacher degree or specialized training. You are, not meeting our standards around, which is based on research around professional development and continuous quality improvement. What that means is that the research that shows what gets outcomes for kids, what gets results, those standards are not being met by Vermont right now. And I have to say that I testified probably 5 years ago when Senator Webb led the committee about what it would take to improve quality. So I did want to give you that context, right? Vermont's program for pre-K is a good program. It's not quite the platinum program just yet. And so there are ways to go to get to your ultimate outcome, which I believe is to improve outcomes for young children, improve experiences for young children. I understand that we're all balancing kind of the finance and the access issues. And that's really what drives a mixed delivery system. I'm going to tell you a little bit more about that, but it is, the federal government does have it in their Every Student Succeed Act, which is the federal dollars for low-income and disadvantaged children. And in part, it is driven by the finance part of this equation. In part, it's driven by the parent and kind of market demand part of, a system of early care and education. Because the theory is that by combining programs or offering pre-K in multiple settings, you can blend and braid multiple funding streams, some of which are state funds, some of which are federal funds, such as Head Start or Child Care Subsidy or IDEA, to provide children with that quality experience. The other is, as Elliot mentioned, is that families, for the most part, do like to have, a choice. And what we're trying to do as policymakers is ensure that they have an authentic choice, of high quality. So this is a kind of a snapshot. You can see here that most pre-K programs nationally allow mixed delivery. Some do it at different levels. There's actually only one state that does not have mixed delivery at all, and that is Hawaii. And that's due to a constitutional amendment or clause that says public education funds cannot go to private providers. And I can chat a little bit more about that model later if you're interested. I would say that the national trend is to move towards mixed delivery for those reasons that I just mentioned as well. I'm not going to go into all of this detail unless you would like to. We know quite a bit about how mixed delivery is delivered and all of that. But given kind of where you're at and what you're interested in, I won't spend any more time. There's lots of ways to do mixed delivery, including the way that you're doing it right now in Vermont.
Does anyone around the table, would anyone around the table like to go through that slide in more depth?
I guess my question would just be how is Hawaii doing with their system, if that is the one outlier? But you can, if you want to wait till the end.
No, I can do it now. It's really no, I mean, I think we can be, somewhat informal, and I can keep going. As I said before, where Vermont stands is that you're serving a higher proportion of children. So how Hawaii is doing that is basically by starting very small, working with those school districts to get the teachers ready, the buildings ready, and expanding slowly each year. Now, this year, the governor has proposed in the budget a more significant expansion and put aside money for facilities and the other supports that are needed. So I think you're going to probably get a message that what I hope the message is that you want to focus on what's quality and then look at what you need to do to ensure that. And so I would say that it is a trend that more states are moving towards a mixed delivery program. Many states allow it, but don't have that many providers. I'll say, like, for example, West Virginia, which has been implementing their universal pre-K for almost 20 years. They started with a 10-year plan. They had a 10-year plan to get 50% of the programs offered in non-public settings. They have very high standards. They meet NEAR's all the 10 benchmarks. Some states do set a benchmark, some don't. My own, our own home state of New Jersey has been working on high quality pre-K for more than 20 years as well. And again, offers it in a mixed delivery, but similar quality standards in both settings with lots of supports. So the conversation you were having when I came on about the agency capacity to local capacity actually to support high quality is really, really important. Are there any other questions, or should I move on?
Go ahead.
Okay.
Question, it's more, I just was going to make a quick comment to the committee, which is that some of us are working pretty diligently on school construction aid, and it does seem like there's an interesting intersection or nexus with anyway, I just wanted to put that on the table in terms of adding capacity to buildings.
Right, and I also, I think that I'm going to say in a couple of minutes, but I'll start it now. There's really no research that we have research that examines how children do in different settings. Okay, and for the most part, children in school-based settings, they are experiencing a higher quality program unless the state is investing in ensuring the quality of the childcare programs. So there are ways to do that, and I don't want to go into too much of the detail, but I would be happy to give you some examples regarding that. Again, I think it's a little bit like any decision, you're balancing different decisions. So nationally, data indicates that mixed delivery programs, families feel more comfortable. There's an increased likely that teachers are from the community and there is some, diversity. However, I did pull up this study that was done on your program in 2018-19. And, the study at that time showed pretty equal quality across the board. So that was, in different sizes and different parts of the country, that they were allowing families to access pre-K and in other locations other than the local education agency did give families more choice. Sometimes, private providers, as Elliot said, a lot of the reason for layering and partnering with childcare is so that they can provide the after-school care. If you're just providing a school day, school year program, then families have to think of what else happens. And any of you with young children know the whole, after-school programs are a challenge. The whole summer camp piece is, is something that families are balancing, and they're balancing, many different choices. So I just wanted you to have this data and to situate it in the fact that you have been implementing this program for a while, have an infrastructure. You're not where you want to be, but you have been moving along towards a high quality program that's serving many 3 and 4 year olds. So now I'm going to get to kind of the reflections, and I hope we can have a discussion, and then I'll turn off the slides in a second. There's really, no research that definitively says one setting is better for children or for families than another. I think it's really important to situate your decision making within the systems analysis that Elliot did, because as a family member, you're touching on all of these systems, especially low-income, vulnerable families are touching on all of these systems. Vermont's program is good in that it's serving almost 60% of 4-year-olds and 30% of 3-year-olds, which is much more than many other states. However, just providing the 10 hours is, less than what would be provided even through your proposed bill. And as I mentioned before, it does not meet the quality standards that's shown in the research to improve outcomes for young children, especially vulnerable children. So, an alternative consideration is investing in increased quality standards. Generally, as I said, we find better quality in school-based programs.
I'm here for a meeting, so it's just daily parking. Daily parking on public.
Wait, I think something's happened.
That's fine.
Someone's not on mute.
Nasha Patel, I think your audio is, thank you. All right, good. That was a technical glitch. So Lori, why don't you continue?
Well, we have one study recently done that we partnered with other folks, and we studied programs that were mixed delivery. And what we found is in New Jersey and Seattle, where the standards and the supports were equal in both school and community-based, children did as well as other children, and the quality was good. So that would be the message to take from that. So here's my thoughts. So I'm going to tell you something that's happening. Just 1 second, please. I'm actually a grandma, and I have my almost 4-year-old grandson with me today. But I wanted to be able to testify before you. So I'm going to let you kind of close with these comments. Just 1 sec. Just 1 sec. Hold on a minute.
It's childcare at its finest.
Childcare at its best. You're still muted. Okay.
I don't know if you heard what I just said to him.
No, you did not. No, you did not.
Maybe that's good. Maybe that's good. I told him, please be quiet for 1 more minute. Okay, here's some things I just want to make sure, and I am happy to have a conversation with you. It's really not certain that all the public schools, especially in Vermont, those that are low income, have the right space for 4-year-olds. So I think the conversation that we're having a minute ago about, facilities, especially outdoor space. So funds would need to be set aside for facilities and renovations. I was happy in the news report I read this morning, I think in the Vermont Digger, that you are getting support from public schools, which is actually pretty good for this bill. The biggest challenge, honestly, to the success of this approach to serving more young children and providing a high quality program is the teacher shortage. There's a significant teacher shortage in both early care and education and in K-12. To prepare and recruit well-qualified staff for the pre-K program and ensure salary parity, it would really be, professionally a disaster and possibly just, a professional culture if you have pre-K teachers working in a public school building without the similar qualifications and without similar compensation. So basically you then have kind of like the stepchild of education. They're not part of the culture. They're not part of the professionalism. And that is really something I would really worry about, honestly. And you'd really need to think about that. As Elliot said, these are not plans that you can put in place short term, but really thinking about because the teacher and the teacher-child interaction and that whole milieu of what supports young children and families is what's going to get you the success you want for young children. So thinking pretty carefully about the teachers and what this might mean for them is going to be really important. At the same time, you don't want to, dismantle the other sectors of the early care and education system. I know you have the increase in the child care financial assistance, which is fantastic. So you do want to really look at and engage with the child care sector, the Head Start sector, because basically we're trying to make sure all boats are strong, right? The whole system is being lifted up. I think to do this well, it would take significant effort and time and plan to build the capacity of local school districts. The local school districts really do need to engage parents and the other community resources in their area in order to do this well. Young children, as you know, need multiple services sometimes, and they are, have relationships with other folks in the community. So, and I'm sure some of your communities already do that well with some local collaboratives, but others may not. So there will need to be some, attention and thought to that. And again, I know it was mentioned earlier that the quality, the monitoring, the quality improvement, the accountability, which is identified in the bill, actually looks pretty good, but the devil's in the details, and you'd really need to kind of put something in place that was really going to ensure that you are understanding what the quality is and you are putting things in place and tracking data so that you could ensure a quality consistently in all settings. Oops, excuse me a minute. All right. So I'm going to stop there so that I can take questions. I know that you have lots of folks and I presented a lot of information. So let me stop there for a moment.
Thank you. Okay, so I know we have questions. I have some. So committee questions. Question, go ahead.
Thank you, Dr. Connors, Tadros.
Lori is just fine.
Lori, whatever. Thank you very much for your presentation. I'm looking at your bullet points, which I think are your recommendations or whatever. Your point about pre-K teachers working in public schools beyond par professionally. A pre-K teacher that's currently working in a public school in Vermont would be part of the union contract for that school and would be part of the salary and compensation package, and they already are in our public schools. So they are part of the salary step and grid in the public school bargaining system already. So I don't think that's a change that is, it's already in place. And are you, unless you're seeing something different, because we have public pre-K programs already in our school districts. In some districts, they're only 10 hours a week, but some districts are offering full-time pre-K already, and those teachers are part of the union contracts.
I think that's fantastic. I think you just would have to do a study really, honestly, by district to see where that's at and whether they have the, the capacity to ensure that all of the pre-K teachers, teaching in the district are paid on par. And that means you would have to have many more, right, pre-K teachers that have a degree. And whether you would also add which we find in the research, the specialization in early childhood, the staff development, the professional development, they have to be part of the system. Now, as I said, there's, pros and cons to both. I just wanted to be sure that, as Elliot said, this would be a big change. And so I do think that some real thought and making sure that what you're assuming is happening is actually going to happen.
Can I ask a
Yeah,
follow-up? So, one of the things it might be a better investment to increase in quality standard, to invest in better investment to increase quality standards. What better than what? Better than what?
Well,
what investments do you suggest in that area?
Well, I would suggest the increase in ensuring that you can get all of all teachers, not only the ones in the districts, up to that BA degree with specialization, with a coaching and professional development plan. So meeting all those quality standards are pretty critical in the respect that for the states that we have data and they've conducted evaluations over time on how children have done, those are the characteristics, or this, basically do what the states who've had success, have gotten, is basically the remark around that. Now, what's bringing down, for example, in all of your childcare programs, not all teachers do have degrees, nor do they in Head Start. Many probably do, or are they paid on the same salary? So that's what's happening there.
Oh, I took the way you phrased it in your slides. I thought you were saying do that instead of, putting money into subsidies or putting money into expanding access or something like it. It sounded like.
I mean, it's like I said before, I think everybody across the country is balancing the quality access, fulcrum. Yeah. And so I think that this proposal is attempting to increase access. And I just want to be sure that you're also, increasing quality.
Okay, I see okay.
Good, that was good, that's clarity for us, thank you. Other questions? I do have a question, I'll ask when folks are.
Sure.
Anybody? Question? No, okay. So you did mention the entitlement hours, subsidy for folks for the 10 hours, and then you talked about New Mexico and Colorado it sounds like they're on a multi-year plan for expansion for their pre-K. And one of my concerns, of course, here is what you've identified, and it's not our job in this committee to decide pre-K or not pre-K, that's in the education committee. But we can certainly consider the time it might take to build all the facilities and to staff facilities to get to the public pre-K across the state. And it sounds like New Mexico and Colorado are in that kind of transition. Am I hearing you?
Yeah, you're right. I mean, there's a number of states. So Elliot mentioned, New Mexico established a new department of early care and education. They developed a strategic finance plan. They are working, as you are, towards increasing access to quality birth to 5. And so that's one example. Colorado also, they will be implementing a universal pre-K, actually rather similar to yours in some regards, with the 10-hour minimum. and then additional hours for children that meet a certain, target eligibility requirements and that kind of thing. So they are thinking about it. I think what Elliot and actually Nasha worked on for them was how to implement, a transition plan in order to transition into that. But I will say, for example, in another state so those are two states that also reorganized their governance and they put all the programs together. In New Jersey, we just, Governor Murphy has been very supportive of early childhood, has been increasing investments in pre-K. So because, of course, we're based in Rutgers and we are the State University of New Jersey, we work with them for, many, many years. But we just completed in the fall a strategic expansion plan for them, which we're operationalizing, which I can send you, additional resources if you would like them. But what I think the expansion plan for pre-K considered was, what is it doing to the system? As any system, you press on one part, it influences another part. And I think that, again, if you implement this proposal, I'm sure it's going to go through some changes. There, you did have at least 1 year of study. You might need 2 years of study. But I think, studying how you implement it so that there's kind of no harm done, if you will, and it's actually building and strengthening the full system.
Yeah, that's very helpful. I mean, it's one of the concerns I think that we've had, from the beginning. We want to make we see the philosophical benefit of what's here, but the practical side of implementation can get tricky when you drop down to the local level. So not to mention the state level. So we'll keep that in mind. And then, so then my other question for you is, you mentioned the 10-hour minimum. My question is, what happens, what might be a benefit of increasing that to 40 hours?
The research supports the dosage, if you will. So we have a dosage in increasing in dosage of a high quality program. So I'll just qualify that. So again, we have a lot of research in New Jersey, but other states as well, both longer, school day, school year, more hours, and even 2 years, as you are, you have 3-year-olds that are getting, more or less 2 years of pre-K. So there is definitely, the research favors the increased dosage of a quality program.
All right, that's helpful.
Especially for low-income children.
I was hoping you'd say that, but anyway.
And I'm happy to provide, it's a little unnerving for me. I mean, I'm happy to provide, resources and other research if you would like it. I know you have a lot to deliberate on, and I think there's others presenting as well, but I'd be happy to provide any follow-up of the research.
Well, you've heard the questions, and obviously the planning process that other states are going through might be helpful to us to look at what they're doing.
Yes, I will. I definitely will send that.
Let me just say this, not simply for our committee here, but for the education committee that will be diving into this a little bit, but we can't be ignorant of what's going on. So Senator Hardy has a question.
Yeah, thanks. When I was writing down some notes, you said that the research shows that outcomes for public pre-K programs are better than private pre-K programs, but that if the standards for childcare are improved, that difference, it narrows basically. And you also point out that in our ranking or our sort of quality standards here in Vermont, we're lacking on those quality standards. The three of the 10 things that we don't do well are the quality for educator credentials and quality. And so I guess if you could speak to that sort of tension, because I think that's one of the the thoughts is that the public pre-K, if that nationally has better outcome because the quality is higher.
Yeah, I'll send you that study. So I would say that the quality is higher for a couple of reasons that they couldn't tease out. One is when they were looking at, say, Boston or New Jersey or other West Virginia, a few others, the children in the public programs tended to be higher income children. So they were starting out a little bit higher. So there is a little bit of a difference when you look at who is in the setting. So I would put that as a caveat, because often in childcare, they are children getting subsidy, and the percentage may not be the same. But as I said, generally, we do find that. I think most states are working to ensure that we don't find that we get the same quality in both childcare and Head Start and in public school programs. But historically, that is the research. Except for in those states that, New Jersey's been working on this for like 20 years since Abbott. And there's very intentional high quality standards for both settings. Similarly in West Virginia, which has had a UPK, a universal pre-K program for a long time. So I do think it's very important to think about the standards and how well all settings are able to meet them. It also doesn't mean that all public school programs meet those high standards either, and can provide all of what is needed for young children. And remember that what I presented on was policy standards, and what you're looking at, as you said, is what's happening in the classroom. What's the day like? What's the experience like?
Right, but nationally, the overall picture is that the public programs have better outcomes. So, and that the standards are not equal.
Unless the standards are high in the childcare program, and there is support for those, like Alabama is another state, for example. They have a pre-K program that meets all 10 benchmarks. They have a very robust regional network that's providing coaching and monitoring so that all programs can participate, all programs meet their high standards.
Oh, yeah, okay, thank you. That's
Thanks,
helpful.
Lori.
Anything else? Any other questions?
I'm going to send you 3 things in, later today or over the weekend. One is the study on the dosage. The other is a couple of the strategic plans that we mentioned. And then the final is the study that looked more deeply into mixed delivery and compared outcomes in different settings. So, and if you think of anything else that you want from me, you can just let Alex or somebody know.
Yeah, no, thank you. That would be very helpful. I'll just send it along to Alex, and then
I will.
we'll share it. We may share it around with other committees as they might need to or want to be informed as well.
That sounds fantastic. I will jump off because my grandson has now made fallen beside me with the pillow. He's ready for me to play. So
thank you for
great
being with us.
Thank you so much.
Appreciate it.
Have a great day. Bye-bye.
Yeah, you
Thank
too.
you.
Thank
Best of luck.
Thank you. Did you want to make a comment, Senator?
Yeah, I did. I just, to our committee, so first of all, I think the 3 of us who are on ed really are looking forward to talking to our superintendents and maybe even some principals to see what this impact will have and, how they feel about shouldering the capacity and so on and so forth. I also think it's important for us as we look at this to recognize that we're mostly a rural state, and that oftentimes our public schools are sort of the one entity in our communities that hold everything together.
Coalesce.
Exactly. And in Burlington, I can say we have great partnerships with our pre-K programs. We also have an amazing public program that is really loved. And we also have neighborhood schools that we cherish. So I just think we're not necessarily in New Jersey or Massachusetts and we have to, and I don't want to do that like Vermont exceptionalism thing, but I do think we have to think about.
No, anything we do
state
needs to
looks like.
resonate and be consistent with what we can do at the local
Right.
level.
Yeah.
Right. Yeah, no, so. All right, so Kate Ritter is here with us. Welcome.
Hi, thank you. Should I sit here?
Please. It's nice to have someone in person.
I'm so happy to be here in person.
Where are you from? Are you local?
I live in Cornwall in
Oh,
Madison
so you're
County.
local?
I'm local,
You're in
yes.
Madison County?
Yes.
Yeah, okay.
So it's really nice to be here in person. Thank you, Senators. I
Well, glad you're here.
really enjoy the face-to-face. I work remotely, so I spend most of the time isolated in my office in Cornwall.
Well, welcome. Why don't you, we've introduced ourselves, and so why don't you introduce yourself for the record, and then I think we have testimony from you.
Yes, I
Yeah,
submitted
that's
that.
terrific. Thank you for doing that ahead of time.
No problem.
Really appreciate it.
Thank you so much for the opportunity to speak with you today. So yes, my name is Kate Ritter. I am the Early Childhood Advisor at Children's Funding Project. Children's Funding Project is a Washington, DC based nonprofit social impact organization that helps communities and states expand equitable opportunities for children and youth through strategic public financing. So when I say strategic public financing, really what we do is we help communities and states gain a deeper understanding of their current funding landscape. We help them maximize use of existing funding streams, generate new revenue, and make effective investments in programs for improved outcomes. In my role as Early Childhood Advisor, I've focused primarily on supporting states and communities in analyzing and understanding the true cost of early care and education. And this has allowed me to do some extensive research on early childhood educator compensation challenges and recommended salary scales. I really am so grateful to live in a state that has shown such commitment to elevating and solving the childcare crisis over the past several years. I thank all of the current and past legislators that have worked to make Vermont a more equitable state for children and families. And I commend you, Senator Lyons and Hardy, for crafting this legislation that stands to stabilize and transform Vermont's early care and education system. The bill's language to implement a minimum compensation scale for early educators is a tremendous step towards growing and strengthening Vermont's early childhood education system. We know that high quality learning depends on a high quality workforce, yet compensation consistently undermines programs' ability to recruit and retain qualified staff. We know also that states across the country are grappling with severe workforce shortages in early care and education. Early educators earn so little, they can't afford to stay in the field. But at the same time, programs can't raise wages without raising tuition, which is already unaffordable for many families. So as a result, the lack of access to consistent high quality childcare costs states billions of dollars each year through lost tax revenue and missed work days. And for decades, this has seemed like just a vicious cycle that plagued the early childhood field. However, recently the infusion of federal relief dollars during COVID allowed states to see how adequate public investment and state policies that appropriately support and compensate the early education workforce are essential strategies to remedy this crisis. Now that the relief dollars are going away, we have seen some states spearhead the work of maintaining public funding to support early educators. So I've just provided two examples of states that are doing that, actually state and the territory. The first is Washington State. They've created a funding stream to support early educator wages and health benefits. So very specifically, they've identified $36 million to implement minimum compensation scale and another $30 million to provide healthcare coverage. And this is possible because of a new sustainable financing strategy where a portion of revenue raised by a new capital gains excise tax will provide ongoing funding for early educator wages and healthcare. The other example is Washington, DC. They've implemented the Early Childhood Educator Pay Equity Fund, and this provides compensation parity between public school teachers and early childhood educators. This fund will also pay for publicly financed health insurance plans for employees in licensed childcare facilities. And it comes from a modest income tax increase on the district's highest income residents. So just wanted to provide two examples of places that are starting to implement this kind of thing. A compensation scale that's comparable to Vermont's public school educators serving children pre-K through third grade is an excellent step towards strengthening the field. But I do encourage the legislation to push further. Some states, such as Rhode Island, are requiring their compensation scales to reflect true parity with K-12 public school salaries. So when I say true parity, that is defined as parity for salary and benefits for equivalent levels of education and experience, adjusted to reflect differences in hours of work and including payment for non-child contact hours, so things like planning time. So this means that childcare educators who usually work 10+ hours a day, year round, receive a salary that reflects the additional time spent in the classroom beyond a school day or school year.
When you say this, are you talking about parity for 0 to 5?
Yes,
Okay.
exactly.
Yeah.
And then still other states are looking beyond public school salaries, which can have their own inequities, and are instead looking at other fields and professions for comparison. I was able to provide technical assistance to Vermont's early childhood workforce in developing proposed minimum compensation standards, and was drawing on the work of states like Oregon and Illinois that are tying their early childhood compensation scales to be competitive with the broader workforce. So without true parity that values and compensates early educators for the critical role they play, the state will continue to lose staff in community childcare programs. As was just talked about, many teachers will choose to work in public schools over community programs. This is a particular concern if universal preschool for 4-year-olds is only offered in public schools. Since these teaching positions offer more competitive wages and benefits than community programs can afford, they will draw more qualified educators away from their current role in the community programs. And this is an overwhelmingly destabilizing consequence for the childcare system. I'm going to kind of skip over the next section because I think Lori covered a lot of it in what she just said, but I do want to say, as a cost modeler, which is what I spend most of my time doing, cost modeling childcare, that from a financial perspective, childcare programs rely really heavily on the revenue from preschool classrooms to balance the high expense of their infant toddler classrooms. And so by having the pre-K classrooms, it allows them to make sure they're getting the revenue that's available to all ages to really stabilize their program. We know that most community-based childcare programs operate on razor-thin margins, so having access to that state revenue is really critical to them. And it also doesn't further jeopardize their financial stability by converting those more revenue-stable pre-K classrooms to the more expensive infant toddler classrooms. So that type of restructuring for a community-based program is very destabilizing to the system as a whole, and it also then makes it harder for those programs to afford the minimum compensation scale for their teachers. So lastly, I do want to applaud the senators for including the language to increase access to the Child Care Financial Assistance Program. Across the state, families of all financial backgrounds struggle to pay for childcare because it is one of the largest items in a household budget. In light of this struggle, an increase to 450% federal poverty level is not enough to ensure that childcare is affordable to all Vermont families. We know that the current reality is that families are struggling with inflation and rising cost of other necessities. And then moreover, childcare costs will increase once the new compensation standard goes into effect. So while reimbursement rates for the financial assistance program are proposed to increase to cover the true cost of care, the impact of these reimbursement rates is diluted because it is only a small part of a child care program's budget. So CCFAP funds are critical, but their ability to shift the larger child care market is constrained unless they're available to significantly more families. A major increase in income eligibility allows CCFAP to act as a really effective policy lever for the early educator compensation scale, while at the same time, it nearly eliminates the cliff effect that occurs when families' income exceeds the program's parameters. So I'll summarize. Children's Funding Project, really happy to be here. We recommend the following amendments to the legislation. One is to increase income eligibility for CCFAP to 800% federal poverty level to ensure Vermont families are able to afford the full cost of care and to ensure that providers are able to meet the compensation scale. And number two, the compensation scale for early educators should at a minimum reflect true parity with K-12 public school salaries and benefits, or reflect parity with other professions in the general workforce that account for role, experience, and education. I do want to let you know that Children's Funding Project also has a team with expertise on generating public revenue to support state and local goals for children and youth. And if you would like examples of how states are finding revenue, maximizing the impact of their funds, or distributing the resources equitably, please, I encourage you to reach out to us at Children's Funding Project. I want to thank you all for being a national leader and considering this important piece of legislation to support the success of Vermont's children and families.
Oh, thank you very much. There's a lot embedded in your testimony. And you have really analyzed some of the questions that we've had about the bill itself and how we can actualize it without destabilization. Yeah, and I appreciate your comments on that. And please do share with us, if you can give some examples of how the funding is going on in other states. Understanding, I think Senator Gulick's comment was appropriate. We're a little rural state. So I don't know what Wyoming's doing, but they're.
I don't know what Wyoming's doing. That's a good question.
Yeah.
But I do know there are some rural states. Montana is doing some really interesting work. And
Okay.
I can certainly have our revenue arm pull together some materials and I can send.
That
it
would
to
be
them.
very helpful.
Absolutely.
Yeah, because we obviously don't make the final decision. We make the policy decision about what will work and how we can move our CCFAP forward, what income levels. We can make that initial recommendation, but ultimately it's a walk down the hall of finance and appropriations. So thank you. Questions? Go ahead.
Okay, thanks. Hi, Katie. It's nice to meet you.
You too.
Thank you for being here. I'm sure the two recommendations you were making that increase the eligibility to 800%.
Mhm.
Well, one of the reasons that we only did go to 450% is because we were trying to phase it in and not immediately jumped.
Mhm.
And we can only do 2 years in legislation.
Mhm.
We can't bind a future legislature. And so that's part of the reason it's like that. I'm surprised to hear 800% because in all of the modeling that I've seen, I know that I see Sarah sitting here, Let's Grow Kids modeling and others, it's really up to 500%. And that is almost nobody in the above that would be impacted. That's the 800% is a really high. So how?
It is
talk to me
really
about
high.
that?
Yeah, so the reason I went there is, so when minimum compensation goes into effect, then the price of childcare goes into effect. So trying to look at that point where the family income's out, they are already essentially, because they're paying 7 or 10% of their income for the copay, once they income out, it's not that big of a jump to then afford the full cost of care with, minimum compensation standards being in effect.
Mhm. Going up to 800. If you have something that specifically shows that your data analysis, I would love to see
Oh,
that.
sure, I can send, I'll send.
I
it.
love data.
Send it to-
I can come over, we have coffee and go over
Yes.
the data. And then
Send that to Alex and we'll.
Okay.
the compensation, I'm looking at the bill to see what the language that's in there specifically for that. The compensation equivalent to K-12 salaries. And what's in there right now is it compensation equivalent to pre-K 3? Okay,
yeah.
okay.
And really just with that, also trying to highlight the idea of true parity, where it's not that they are getting the same salary, but they're getting the same salary plus the prorated amount for the additional full year and additional hours per day that they work.
Okay, okay. And then the final thing is that the whole the differences in salaries between the private and the public. I mean, the bill, the intent and the what we were shooting for is to make parity between the two so that there's not this sort of inequality between the public and the private pay scales. And then that the subsidies would match with total cost of care so that they would pay. And as they're increasing the percentage of poverty level, more and more people would qualify for the subsidies. So it would cover the cost of care in the private programs. So that's the intent of what's in there, but I'm hearing.
So you're wondering why I said comparing it to other professions and industries?
Well, I guess the sort of destabilizing comments that you were making, yeah.
Right, so that's more about teachers being pulled then into public schools or even other industries where they say, okay, I've now achieved my BA, I can earn this much more if I go work in some other profession.
But if we do the compensation scale that's equivalent to full K-12, would that decrease that?
I think it absolutely would. I will be just completely transparent that I haven't looked at the full, comparison to the rest of the broader workforce in Vermont, the way I did in Illinois.
Yeah, because I think that in many communities, and I would venture to guess in Addison County, teachers are actually some of the highest paid people in our communities. And so.
Wrong with that.
Yeah, I mean, that's a good thing. I'm not saying it's a bad thing. I think it's a great thing.
Yeah.
I think everybody should be paid more. Well, not everybody. So I think the parity to other industry, quote unquote, industries may not be as relevant to the really rural Vermont economy because our salaries overall are lower in the state, and teachers sometimes are some of the higher paid people, and especially as Senator Kulik was mentioning, in very rural parts of our state.
Yeah.
So that might actually bring salaries down.
Right. So then I would encourage it to be a comparison to K-12 with true parity to account for the additional time.
As you were talking, I was thinking that's what I was thinking about, regardless of the other industries. Although, when you see someone with a bachelor's degree in liberal arts going out and earning $500,000 and a teacher with a BA in early childhood education at the really low level, it becomes concerning.
Should make parity to, corporate CEOs.
So, questions?
These are very hard.
It's a wild world out there. Any other questions for Kate? Kate, I can't tell you how much we appreciate your being here and coming in. And if you can get us that additional information, you've heard some of the questions, and we'll continue to have discussion. We may have Alex reach out with other asks.
Absolutely.
That would be so terrific.
Yes, certainly. I will pull that information. I made some notes of what you asked for, and I did also provide a PDF of some children's funding projects, larger work of revenue.
Here, we have it. It's great. Well, we're gonna all have to dive back into all the testimony that we've heard, so we get some clarity on where we are. And when that happens, then we automatically have further questions. So this is our first look at all of this information for many of us.
Well, I'm happy to answer any questions. I'm happy to come back anytime. Senator Hardy, happy to see you.
Yeah.
That's good.
Thank you.
Right down the road.
Yes.
Thank you. All right, committee, I'm going to suggest like a 5-minute break, if you don't mind. We'll come back here at 10:35. Please, at 10:35, Alex, we'll go on.